Alright, all the providers have standard precautions in place, and the first thing I'm going to ask my partner to do is to manually mobilize the foot and leg. And the reason we do that is because femur fractures produce intense amounts of pain. I'm going to check the distal pulse, which is fine. Feel that?
Yes.
Feel that?
Yes.
Can you wiggle just your toes? Okay. Now, the next step in this process for me is to apply the ankle hitch. You'll see various different types of skill sheets that will tell you to put this on at a different point, but to me it's easier on the patient to apply it this time. The ankle hitch cradles the foot, wraps around the ankle, and allows you to pull traction on the patient. So I'm going to slip this behind the ankle at the hollow point, pull it underneath as gently as I can, and wrap it around the ankle. Okay, you can also go back and check the pulse if you're concerned about whether or not you applied it too tight. Okay, I'm going to take over manual mobilization, and I want you to come down and pull traction until the feet are equal in length. Okay, once traction is applied, I'm going to prepare the half-ring traction device to apply to the patient. I'm going to pull my strap out to its maximum length. I'm going to lower the foot stand, and I'm going to set it to its correct length. All of these splints can be lengthened or shortened to accommodate patients who have varying lengths of leg. You want the end of the splint to be roughly 1 foot past the end of the patient's feet. So this needs to come out a good 8 inches or so. That's now done. I'm going to go back and check to make sure that the riders, which support the leg, are proximally placed here at the groin, just proximal to the knee, and just distal to the knee, and you want this lowermost rider just proximal to the ankle hitch if you can get it. Okay, what I want you to do is elevate the leg a little bit, and I'm going to slip this underneath the patient. You ready? Okay, the next step is to apply the ischial strap. These things are always, today, just about Velcro in nature, so you simply slide it through that ring, pull it taut. I'm now going to apply traction to the patient by hooking the ankle hitch onto the strap. Okay, lower it down. The rule for applying traction is to apply traction until the feet are equal in length. If the patient has an amputation on the opposing side and you don't have a foot to compare to, you pull traction until the knees are equal in length. If there's an amputation on the opposite side and you don't have a knee to compare to, in a conscious patient, you would pull until pain is relieved. In an unconscious patient, you would pull until the muscle spasms in the thigh cease. For a patient who has an open fracture, you would pull just until the bone ends begin to move, and then you would cover with a dry sterile dressing. Now we're simply going to go back, apply all of our riders. And again, you want this one just proximal and distal to the knee. And try to stay off the fracture side if you can, so the fracture side should be about there. Okay, go ahead and release. I'm going to check and make sure I have a distal pulse, which I do. Feel that?
Yes.
Feel that?
Yes.
Wiggle your toes. As a final thing to immobilize the patient, we're going to place the patient onto a long spine board, and we're going to immobilize the device to the long board itself. Usually you would tie the foot stand to the board.